Hi everybody. I am very happy for this meeting to have Dr. Bal Pawa with us for our Mind Body Reset Summit because Dr. Pawa is really an expert in the field of mind body. Dr. Pawa co-founded the West Coast Women's Clinic. She is the author of the Mind Body Cure, which is a fantastic book that is about to be released, and I'm sure Dr. Pawa will tell us about it. Dr. Pawa is also a TEDx speaker. She's been speaking all over on stage many times over, and she's a fantastic speaker. I'm super happy to have you with us. You are one of the pioneers and one of the champions of integrative functional medicine. And so all of that is so useful for people to hear your point of view, Dr. Pawa, today, when we are inundated with news that are sometimes quite stressful, to say the least, and sometimes people don't know what should I do, what practical steps can I even take, to help and release some of the stress and just feel better overall. So Dr. Pawa, you have an immense knowledge. I'm super excited to hear your information that you have to share with us today.
Thank you, Laurent. Thank you. It's a great opportunity for me to be speaking with all of you. And Laurent, you're doing a great job as well to bring awareness to this whole how we respond to something like the COVID-19 pandemic. And this virus, this tiny little virus, has brought the world to its knees. It's been a very humbling experience. And it's forced us to live through this incredibly unique time, but it's giving us an incredible opportunity to examine how we respond and what can we control and what we can't control. So for me, as you know, the stress response is a big part of my research, and it began many years ago. I was a family doctor, and I think you know the story about how I became a patient. So I left the hospital as a physician, and an hour later I returned in an ambulance as a patient after a horrific car accident. And as a physician patient, I realized the gap that was in our healthcare. And we are missing, the way our body responds to stress. So this COVID-19 has again brought to light how our body responds to stress. We have acute stress like the fight flight reaction. We all know when your heart rate beats very quickly. But then if the stress is prolonged, and look at this situation now, it's prolonged and it's causing fear, hopelessness, anxiety, feeling of uncertainty. When your stress level is prolonged, your hormones like cortisol, adrenaline are wreaking havoc with your cells. And that changes a lot of our biology. And eventually, if it doesn't turn off, it causes disease. 75% of all the symptoms that end up in a doctor's office, this is according to the American Medical Association, can be attributed to excessive chronic stress. So it's very important for us to take COVID-19 as a good example to examine how do we respond to stress.
Yes, thank you so much for like framing it that way, because we know, and that is a topic we discussed in our film on a scale of 1 to 10, how much stress contribute to chronic disease, even chronic pain. So could you share with us some of the solutions, some of the concepts that you are sharing actually in your book, The Mind Body Cure?
Okay, so I'll preface it by this. First of all, it's really important to know, when we have that fight-flight reaction, think of the motor inside your brain. It's called the autonomic nervous system. It's in your brainstem, and it automatically functions. And there's a huge, big nerve called the vagus nerve. So it's not like Vegas, the casino, and the gambling Vegas.
I like your sense of humor.
Unlike that Vegas, what happens is that Vegas stays there, but this Vegas, it doesn't stay there. This is called the wandering nerve, because the vagus nerve is in touch with your heart, your lungs, your gut, almost all your internal organs. And the autonomic nervous system communicates with the vagus nerve. So while you're sitting there, it's making your gut work, it's making your heart beat. So it runs on its own. That's why it's called autonomic, okay? Automatic or autonomic. But when you get stuck and your brain is constantly running a circuit of stress, then it's like the gas pedal is stuck on that motor. So we have gas and brakes, gas and brakes. So if your gas pedal is stuck, you are producing cortisol and adrenaline all the time. And that's what causes the problems. What I want to teach people is you must consciously turn on the brakes. You don't have to think about stress. It's automatic. It happens. But stress and relaxation are the opposite. Relaxation is a conscious response. So in order to turn on the brakes, we must engage the vagus nerve. And I teach how there are 3 things that you can do to bring about the vagus response or turn on your brakes. And, you know, we were talking about earlier, the COVID-19 is something we cannot control. We don't know what's going to happen. There's so much uncertainty. But you can control the way that you breathe, right? We breathe 23,000 times a day. And when we're born, we take our first breath. When we die, we take our last breath. And everything in between is what we call life. So we cannot control the fact whether we breathe or not, but we can control how we breathe through the vagus nerve. So taking a deep breath in through your nose, holding it for a few seconds, and then exhaling engages the vagus nerve. So control how you breathe. That's the first way to maintain some control. So I call it the BMW meditation: breath, mind, and word. So first step is breathing. And while you breathe, relax all your muscles in your body, because muscles, when they're relaxed, also turn off the gas and turn on the brakes. So that's the B. The second part is engaging the mind. And as you know, Laurent, the mind is a very powerful machinery that's always on. We have 60,000 thoughts a day. And many of them are repeat thoughts from yesterday and the day before, and they're automatic. Most of them are fear-based thoughts. But if we can live in the moment and just be very aware of what our thoughts are and be in the present moment, not thinking about future, what's going to happen, not thinking about the past, but thinking right now in this moment, you have power. So bring your mind to the present. So combine your breath and awareness of the present moment. That's the second step.
And can I say something there, Dr. Pawa? Because that is such an important point you're making. And, you know, we hear it a lot that, you know, we need to live in the moment, but a lot of people have trouble doing that.
Yes,
So maybe
such an easy way to exercise control is to bring your mind and train your mind to be in this moment.
right. And so with the breathing, the breathing would help to do that, obviously.
Yes, so
Right?
breath brings you back. Just focus on your breath. Your mind is linked to your autonomic nervous system and your vagus nerve. So as soon as you start breathing, focus on the breath, your mind. And another third thing that helps, Laurent, is if you say a word, pick a word that resonates with you. Peace.
Compassion.
Yeah, whatever works. So BMW is breath, mind, and word. And just start your morning with that intention. And that's a good way to stress proof your body, because you can use this exercise to start your day, set an intention, and say, I'm going to unplug from all the news and be aware, make choices about what you want to listen to, what you want to do, and live that day with intention, live in that moment with intention. And that is a very powerful way to exercise control over how we respond to situations.
And you know, you mentioned earlier that there are things we can control and there are things we cannot control. And that's also a very powerful statement. there's a tendency for many people right now, and it's easy to get caught in it. And sometimes I do get caught in it.
Yeah,
To just go to the news. You turn on the computer, you punch in CNN, or you turn on the TV, and the news right now are extremely toxic. So
very.
I think there is a balance probably to be found between being aware, having some information that is important to have, and at the same time, because there is nothing we can do to change the situation in New York City or Italy, or it's out of our control, or the murders in Halifax, we know there's nothing we can do there. But there are things we can do in our small, for ourselves and for the people around us. Calling a friend and asking a friend, how are you today? Making that
That's
friend feel better. So could you
so.
share with us maybe some of that concept to kind of let go of the things we cannot control, but be more in charge and be more present for the things we can control?
Okay, that's an excellent point. What you're asking people to, inviting them to do, is actually shift their mindset. It's easy to change your mind, but it's more difficult to change your mindset. So, mindset is the way you look at the world, the set of the lenses that you view the world. So, when we shift our mindset, for example, to gratitude, being very, very thankful that we're confined to a home, but at least we have a home. Many people who are in countries that they have to be quarantined in their home live in corrugated tin shacks. So we should be thankful we have a home and be grateful for all the things that we do have. So shifting your mindset and reframing what we have instead of what was missing, instead of confinement, look at this time as a time to go within and become introspective and expand your awareness. So that's an excellent point. Gratitude. You can become more inspirational to others, doing things that would improve your self-care. First of all, do extreme self-care for yourself and then give back to others who cannot get care for themselves. Reach out and inspire others. So that's an excellent way. There are other coping strategies. Get out in nature, for example. Get out of your home and add some quiet time to your repertoire. Instead of being in your apartment, you have to be socially distanced, but you don't have to be so socially isolated. So going into nature, looking at what's out there, you can reach out to friends. With technology, we have the gratitude of technology. Look at you and I, we're communicating with technology, and I'm having Zoom parties every day. You can use this technology to connect with others and cultivate wonderful relationships. All that is good for your autonomic nervous system too. So those are some things that you can do. And of course, exercise. Don't neglect your exercise and your nutrition. All of those things, exercise, nutrition, and sleep, are the cornerstones of health. And if we keep our immune system healthy by providing really good food, really good sleep, quality and quantity, having good thoughts, being time in nature, having social connections, all those things actually reinforce our gut health and our immune health. Because our immune system, 85% of it is found in our gut. So keeping our gut healthy by having low levels of stress, managing stress, having an excellent diet, are good ways to actually indirectly support your immune system.
Well, thank you for these important words of wisdom. Well, the sleep part is becoming an issue for me lately, but
Is
that's
it?
so many people. I just wanted to say something about gratitude a little bit because I think it's so important. Recently I was reflecting on the situation we are in today, and I am a passionate table tennis player.
Okay.
I'm playing 3-4 times a week in 2 different leagues and tournaments and training and all of that. Of course, all of that has come to a stop. Many people out there who are also very active with the sport, let's say, they can't play that sport anymore. It's very difficult after a while. You really miss it. There are other things that we miss, maybe socializing, going to restaurant. But I
Mm.
reflected on that, and there was a time in my life where I had really serious back pain with a seriously herniated disc. And for a couple of times, a period of 6 months at a time, standing was painful, sitting was painful, laying down was painful. I could not tie my shoelaces. I could not do anything. So, a few days ago, I was reflecting on, missing playing table. And then I realized, wait a minute. Like, you had these times in your life where for 6 months at a time, you could not come to even close to a table tennis table. You could not do, and you had to deal with pain 24 hours a day, like so many people. And I think, I don't have pain. I don't have any pain. That's wonderful. And what are all the other opportunities we have today? Like you said, spending more time with friends on using technology, listening to some more music, reading more, looking at a sky that is not polluted because there are no cars in the city. So there is a lot of things that if we look at what is going on, that we can look at it from a different perspective. I have friends in France that I talk to on the phone that live in a 250 or 300 square foot room. And there is no view. And they are stuck there. And in order to go out, they have to show a piece of paper why they go out. And they can only do it within a short, 1 kilometer outside of their home. It's very restricted. And they still find other ways to enjoy their life. They have to, right?
Well, what you're doing is a great coping strategy. What you're doing is called, in CBT terms, reframe. You're reframing, you're stepping back and choosing to take a different perspective. Instead of saying, I'm confined in my home, I can't go to restaurants, I can't go to church, I can't go to work, then you're reframing and say, how can I make it work for me? Turn a crisis into an opportunity. You create a restaurant in your own home and make a beautiful meal and share with your family. Or you start doing your meditation and prayers at home instead of the church. Or you reframe it and say, okay, now I have an opportunity to work virtually from home. So we learn to adapt, and adaptability is a key component of coping with this, is learning to adapt to a situation and making the best of it. So you're doing that, Laurent. Good for you. So that's wonderful.
So Dr. Pawa, could you share with us what motivated you to write the book?
So Laurent, as you know, I've been in this medical system for 30 years. And previous to that, I was a pharmacist. So as a pharmacist, I filled prescriptions. As a doctor, I kept writing prescriptions. We have a pill for every ill because the medical model that we have is an illness model, not a wellness model. And then as a patient, I was actually taking those prescriptions. I took painkillers, sleeping pills, antidepressants, because I was suffering with a lot of chronic pain, PTSD. I had a really traumatic accident. And so from my perspective, I realized that if we just give a pill for every ill without going to the root cause of the problem, then we're really not treating the problem. And I, as a physician, could not go back. Once I made that conclusion in my mind and I started shifting and transform my own health, I started to transform the thousands of patients that I was seeing. I said, I have to help them. So my conscience would not allow me to just go back and write prescriptions. I started to explore their mindset, and I started to explore what is it that is at the root cause of their chronic pain and suffering, or their gut health, or their autoimmune disease. And I was fascinated and intrigued by the research that all those things had a common denominator. 75% of the symptoms, the common denominator was chronic, perpetual, excessive stress hormones that were present in our body. And until you fix that, you cannot fix the problem. You're just throwing medication at it, but you're not actually fixing the problem. And once I started that approach, I started a clinic 20 years ago and co-founded the West Coast Women's Clinic. That was the premise of integrative medicine. I look at the mind-body connection. I look at the lifestyle and the diet that they choose. I look at whether they exercise, if they sleep. all those things contribute to the wholeness of our body. Our body works as a unit, not just a sum of its parts. And so when you're treating a patient, you have to look at their mind and their body and even their soul as to what they believe and what their connections are with people. And if they believe in something spiritual, that's great too. But treating a person from a holistic perspective, it has given me so much reward as a physician because I see outcomes. I see people getting better. And that's what gave me the passion to say, I've got to get this message out there. I'm at the sunset of my career, but I can mentor younger doctors to say, don't just throw a pill at it. I beg of you to look at the root cause, go to the root cause and explore other things and find out, why are they making bad choices? What are they suffering from? Is there something that they're running away from? What is going on in the mindset? So that was what fueled my passion to write the book, is because everywhere I would go and speak, they said, do you have a handout? Do you have a handout? And I had it all in here. So now it's on paper. And I made it very simple so people can access the information. It's called the Reframe toolkit. So the Mind Body Cure is a culmination of my experience as a pharmacist, as a doctor, as a patient, and then it's made so it's accessible to everybody at any stage of their health. They can optimize their wellness.
Well, first of all, I wanted to say you might be at the sunset of your career, but it's a beautiful sunset.
Well, I call it the sunset because I graduated very young from high school. I was 16.
But you're super active. You've got a lot happening going on. And even now, I mean, and that's something maybe you could mention. You are actually, helping patients, remotely. So could you share that with the telemedicine? Could you share that a little bit?
Sure. Telemedicine, as I was saying, I'm so grateful for technology because it allows me as a physician to continue to help. And this COVID-19 pandemic has unleashed a huge stress pandemic. And I give you tools, I give patients tools to stress-proof their body so that they don't deal with the pandemic of this kind or any stress. But virtual health is going to be our future, Laurent. That is going to be a way that doctors can connect with patients. We're not going to fill up waiting rooms with sick people. We're going to try to do things virtually. And the future of medicine is so exciting with technology because you're going to have wearable devices that can check your autonomic nervous system, just like your Fitbit. I will be able to sit in my office and get your heart rate, your blood pressure, your cholesterol, blood sugar, all those things will be tapped into my computer in real time, and I could be giving you care. So mental care, of course, but also physical care to help your body cope with some of the symptoms. So that's very exciting, the virtual medicine that's this COVID-19 has just accelerated it and brought it to the forefront, but we were doing it for the past 2 years.
Yeah, that's picking up more now, obviously, because
Yes.
you can't have, and you are helping people every day.
Yes, and through virtual health, I think that, you and I you're in Saskatchewan, I'm sitting here in Vancouver, but we're communicating. We're seeing each other's facial expressions. It's much better than a telephone. You're reading my expression, I'm reading yours. So that human connection is still possible, and I think that's very important. We're biologically wired to be connected to each other. And this COVID-19 has made us realize that it's a great equalizer. No one is any less or more. It doesn't matter what profession you're in. It doesn't matter what country you're in. We're all vulnerable and we're all connected. And this is the important message that I send to people, that you may be in social isolation, but it's important for you to stay connected. We as human beings do better mentally and physically when we remain connected to our loved ones and our caregivers.
Dr. Pawa, the steps that you would say would be very important for people to take. We talked about breathing, we talked about mindset,
Yes.
words, the BMW. nutrition. You talked about gut health, nutrition, exercise. Could you expand on that a little bit and connect it maybe with the situation people are in right now? A lot of
Okay.
people are concerned about right now they're gaining weight or whatever because they feel they are not out enough. They are not, what can they practically do?
Okay, so the best way to remember it is remember this mnemonic, okay? It's called reframe because we're looking at things differently. Remember we said
Yeah,
reframe.
friend. Yeah.
So R is for reset, and I'll go through each one. E is for exercise, F is for food, and the second R is for rest, the sleep. M is for mindset. And then the E is at the end for examine. Sometimes you need to be examined. So let's go through the first one, reset. And you love that word, I
I
know,
know it.
because you and I have
90
talked
reset.
about
That's
it.
important.
Reset. What I talk about reset is resetting your nervous system, your autonomic nervous system. So one of the ways was the BMW meditation, breath, mind, and word. Inhale, hold, exhale, and as you exhale, repeat a word and put your mind in the present moment. So that's the BMW. That's a very good way to reset your nervous system. E is for exercise. When you burn off cortisol and adrenaline through getting your heart rate up, that is an excellent way to build serotonin in your brain as well and burn off stress hormones. So exercise is really important. Even if you're socially isolated, just go for a run, or at home, just run on your treadmill or do jumping jacks. There are so many YouTube videos that you can exercise at home. So utilize those. F is for food, nutrition, making healthy choices about eating and being very mindful of when you eat, because most of us are stress eating or eating out of boredom. So be careful about the quarantine 15, right? We're gaining a lot of weight by sitting around. So it's very important to make good health choices and be mindful of your emotional state. Why are you eating? Are you just going to the fridge automatically? Are you bored? Are you stressed? So examine the emotion behind the eating. So that's the food. The R is for rest. And when I say rest, I'm talking about unplugging from your electronics, from the TV, and just going within to examine your thoughts and examine your meditation practice, and also to get adequate sleep. We talked about how important sleep is, because when you sleep, you actually manufacture hormones that repair your body and keep you healthy. Melatonin, growth hormone are just some examples. The A for reframe, A is for assess. Assess yourself. Do a little assessment every day and say, where am I? What symptoms am I feeling? How am I feeling? Because thoughts are the language of the mind, and feelings are the language of the body. But thoughts and feelings are what contribute to your actions and your behavior. So if you're making bad choices, go back and examine the thoughts, feelings, and then why you took action and why you behaved a certain way. You didn't exercise or you didn't eat the right foods. So your choices are all dependent on the thoughts you think. So do an assessment. And I have some assessments in my book on each chapter that I go through with patients, because I think it's important for patients to look at their own assessment. The M is for mindset, and we talked about how important it is to create a mindset of resilience. We have an illness mindset and we have a wellness mindset or a health mindset. So in order to stress-proof your body, create a very solid mindset. And a good way to do that is a formula I call SODA. Stop. S is for stop. O is for observe. Observe your thoughts. D is for detach from your old automatic negative thoughts, SOD. And A is affirm new thoughts. So SODA formula allows you to create a new mindset and shift out of your old fear-based thinking to establish a new trust-based thinking. So that's the M. And the last part is E. If your symptoms are getting very serious, you can't breathe, for example, or you're getting chest pain, or your sleep is out of control, be responsible enough to get the help you need. Your doctors are available through virtual phone calls now. So get the examination. Sometimes you can't have all these self-help tools because the symptoms are severe. I had a lady that I examined on the phone yesterday because her hands were bleeding. And I said, "Why are they bleeding?" She said, "Because I'm so anxious about this COVID." She was washing her hands about 30, 40 times a day, and they had cracked the skin. So sometimes anxiety can escalate to a physical symptom, and we have to be aware, and it helps to have an objective opinion of a healthcare provider. So be examined when your symptoms are more severe.
Yeah, I've been saying
That is good. Reframe is a good toolkit
it
to
is.
this COVID crisis. It's something that people can remember.
I have been saying kind of jokingly, it's good to still have some humor in a situation like that, that I've been washing my hands so much lately that I have hardly any skin left.
I know, and humor is so important because I'm sure you're reading all the numerous jokes about COVID-19. And I read one this morning. Remember, we used to say, "Oh, I wouldn't touch him with a 6-foot pole." Well, now it's true, right?
But the thing is, and you talked about the soda, what you call soda. That's a very, very, very powerful analogy and a very important message. You know, one of my mentors, and I try to practice that. I probably learned that from one of my amazing mentor by the name of Krishnamurti, who I started reading in the 70s, you know, when I was younger.
Right, okay. We won't go there.
I was listening to the Doors and reading Krishnamurti. I'm still listening to the Doors, and sometimes I open a book from Krishnamurti. And Krishnamurti talked a lot about the observer, you know, like, so he had that concept of we need to kind of step out of our mind and observe, right? And it can detach a little bit. When you do that, I find that you reset your mind and you can become more in the present if you get into the habit of having that observer attitude.
Mhm. Yes, that observer attitude, I think, is one of the key therapeutic interventions, because if we don't have that ability to observe ourselves, that, by the way, is called metacognition, the ability to think about who's doing the thinking. Sometimes you say, "Why did I say that? Why did I do that?" So when you examine yourself, that silent witness inside, that's called metacognition. Your mind is very different from your brain, you see. Your brain, I could take a cadaver, open it up, see the brain. I can take a CAT scan of somebody's brain. It's a physical organ, and basically our brain is just a tape recorder. But our mind is something very complex. It has many dimensions, your subconscious mind, your conscious mind. So the ability to go within and examine who's doing the thinking, that metacognition. Soda is a great formula to do that examination. And when you get in touch with that person, you can make all kinds of shifts in your thinking and in your behavior. But until you go within and be in touch with that observer, you might have read the book called The Untethered Soul by Michael Singer.
I know the book, I haven't read it.
It's a fascinating book, and he talks about how important it is to have that ability, but I call it metacognition, basically thinking about what you're thinking, the thinker. And when you get in touch with that thinker, some people call it your higher self, you can accomplish anything when it comes to health. And that's when the shift happens and your autonomic nervous system takes cues from this metacognition ability. So when you do soda, you actually are changing your autonomic nervous system, because our thoughts are inextricably linked to the autonomic nervous system. You can actually create health instead of disease. So you start producing neurotransmitters.
Well, and today it's a message that is more important than ever in the middle of that pandemic situation.
I think,
you know, to give people this, to remind them of this, and giving them these practical things they can do can make a huge difference in their lives. So tell us about when will your book be available, and where will
Oh,
people be able to find it?
well, you can order it online at Amazon pre-order right now, but the book is set to be released in the bookstores on September 15th. And I talked to some of the U.S. Office and American and Canadian publishers, and they're very excited about the book because they said the timing is perfect because of the stress pandemic that is out there. So I'm very fortunate to be releasing it at a time when people really need tools to deal with stress. And so I'm very excited. I had to cancel a lot of speaking engagements, so most likely I'll be doing online teaching or virtual presentations at conferences, but we find a way around it. The main thing is to get the message out there that people need to take charge of your health. You are your best doctor. I'm saying this as a physician, okay, Laurent, that you are your best doctor because you know your mind better than anyone else. And if you take charge of your health, then you can make all the changes and the choices that you need to do. But first of all, you need to connect by going within and then taking charge of your health and your autonomic nervous system.
I was going to say anyone else except my wife, Jennifer.
Okay, okay, second to your wife. Yeah.
But okay, this is really excellent. It is so timely. You know, I think the content in your book, I can't wait to read it. I would encourage as well people to actually get the physical book. There is something about having the physical object at home. You know, go back to it. You know, read a few pages at night before going to bed. You know, and then there's something about that that cannot be replaced. And I'm sure it's going to be beautiful looking. Because I know you've got an artistic mind, artistic taste. So I'm very much looking forward to talk about the book more to our network and the people who kind of follow us. And I'm super happy that you shared these words of wisdom with us today. And I thank you for the work you do, helping people through telemedicine, as you know, as it is so important today. So many people need help. And yes, I want to say thank you again.
Thank you. It's a wonderful opportunity to speak with you and to your listeners and connect with everyone. I hope you stay safe, and I hope that everyone takes charge of their health, and we're all going to get through it. It's going to be okay. We're all going to be okay.
Thank you very much, Dr. Pawa.